Stitching to Radio Democracy 98.1 FM. Well, Fambule made already time. We're going on our studio 2 and we come the program. Good morning, Salon. Stay tuned.
The program Good Morning Saloon will come to you live from the Society for Radio Democracy 98.1 FM. Today na Tuesday, April 1st, 2025. And we bring the program to you this Tuesday morning. My name is Usman Kamara.
And Musa Kamara, na my name. Good morning. Inside today's edition of the program Good Morning Saloon, the Chief Technical Advisor for the Opportunity Saloon Program, now the International Labour Organization, Tundari Monatu, say the National Feeder Road Policy with the Saloon Roads Authority and partner in the review now go help guide road construction projects them in the country. The Communication and Public Relations Officer for the National Tourist Board, Kai Bokari Sakwi, say the rumor where they go around say them plan for Poel all the beach bars and restaurants there at the beach, now the Lumley Beach, not so true. And today inside the program, Radio Democracy go talk to the Minister for Information and Civic Education. We go talk about government activities them we don't happen at the country recently.
With this and plenty other story than they for inside the program this morning, plus President's Bill, the appoint Dr. Sylvia Olainka Blyden as gender advisor na status last night. Members see the list will live on www.radiodemocracy.sl and members in Ali Rock Metal Group, the sponsor Radio Democracy for bringing the program Good Morning Salon can to you. And this program is powered by Afisel. You listen will live from Radio Partner them, Radio Shallow 89.5 na Koinadugo and Falaba District. Same also on Radio Maleng 88.5. Radio 1G11.3 na Pujon District, Radio Colente 90.0 na Cambia, Radio Mwa 105.5 na Kainlang, Vopad Radio na Watalo, Voice of Sandon Radio 95.7 na Kono District, Voice of Karine na Kamakuyo 98.0, Voice of Masoro, Pujon District, Jange Radio 99.3 FM na Lawabon District, and Advocacy Radio na Putloko District. The program na Good Morning Salon where they come to you live from Radio Democracy 98.1 FM. If you want to be part of the program, you can send in the message on Radio Democracy Facebook page or drop in a message on the number 077-981-981. But Musa, before you take your first material, how the holiday?
It's been the holiday. I just be wish you continue to the week more.
Thank you. We don't done the fast
yes,
easy
of
one.
course. I hope the Sheikhness, Sheikh Usman, the Sheikh Wabi Sabi Ramadan will continue.
We'll continue. Play.
Inshallah. The program Good Morning Salon they continue. We start for look at issues. We go say the Chief Medical Officer and the Minister of Health, Dr. Sati Kanesi, the ministry they work now with them partner them for reduce neonatal mortality to 12 deaths per 1,000 births by 2030. It took this inside one graduation and conferment ceremony on 25 Nostem for the second cohort of the post-basic certificate in neonatal nursing. For more on this, we join Khalifa to contain.
Don't be sideways anytime you woman born. The next thing are how the picky whether in survive or not. Because plenty people believe say salon ton graveyard for belle woman where they go for born. Also, according to the United Nations Development Program report 2017 to 2018 shows say anytime pikin born at the country, impossible say 3 out of 10 pikin they when they born no they live na salon. This na be concern. 2 sets of pikin and day where the one and day na impossible for die. The neonatal when a pikin them from where them born them, so them first year birthday then kid don't die. And safe, the child mortality when a pikin them from 1 to 5 years, plenty pa them can cut short. This concern na problem to the health sector, and at this, the Ministry of Health want for correct plenty pa they wrong gear and make salon they eye na the sustainable development goal when it comes to health issue. But for make them get them right, one set of people will able for change this. Now the well body workman them where they handle maternal mortality. Now nurse them. For sake of this make over the weekend, the Ministry of Health together with the development partner them don't do the second cohort of the post-basic certificate in neonatal nursing for 25 nurses in the country.
If we're going to develop our country, we need to ensure that we start with the newborns. The first 28 days of life are very critical, and I'm sure all of you know this. And today you will join a distinguished group of healthcare workers and service providers who are equipped with the skills and knowledge, but most importantly, with the compassion to care for human beings when they are at their most vulnerable. But as you go back to the districts, to your health facilities, to continue to serve the mothers and babies of our beloved Sierra Leone, I ask that you do that with the same spirit of sacrifice and selflessness that has led you to where you are today.
That's na the Director of Reproductive and Child Health na the Ministry of Health, Dr. Francis Moses. They talk about the importance of this training. But waiting are some of the things them what they want to achieve after this training on neonatal nursing. Dr. Adetola Ahmed Hassan, na the coordinator for the post-basic certificate in neonatal nursing. He explained.
The course aim is to increase the essential knowledge and skills and also the practice, especially the attitude of nurses working in the SCDU so that they can be perfect, they can be better, and to reduce the morbidity and the mortality. To understand this, the Sierra Leone standard SOP in a newborn care and be able to do it, and to increase the quality of care in managing of newborn. That is our goal. To this extent, Ministry of Health, with support of UNICEF, organized the post-basic certificate in neonatal nursing. I remember it took almost like 4 or 5 years to plan this thing, but it eventually started in January 2023, when we have 21 students in the first cohort. They are all from the regional hospital and the district hospital. And this second cohort started on the 1st of April 2024 and finished on the 23rd of March 2025.
As UNICEF, now one pan the development partner they don dey support government and the well body sector. Make the deputy representative na UNICEF, Liv Ellen Endrington say this initiative now one way go help reduce neonatal mortality and save life na salon.
The building of the skills of the neonatal nurses is contributing to reducing neonatal mortality and saving lives. This is really important. The data shows that Sierra Leone has quite bad neonatal and child mortality, and it's something we need to work on. You are key in changing this. Please understand, you are key in changing this. So now with your new important skills, you are now new leaders in this field. Better services and quality depend on how you practice this in your work.
Where in Bidegi in keynote address, the Chief Medical Officer at the Ministry of Health, Dr. Sati Kenneth say, the ministry they work now for reduce neonatal and child mortality to 12 deaths per 1,000 live birth by 2030.
The neonatal mortality rate has moved. We evolved from 40 per 1,000 live births around 2010 coming or before that. And now by 2019, we were at 31 per 1,000 live births. Just made about 9. And now we are saying by 2030, we should really reach the international standard level and we'll be at 12. But that is what drives the Ministry of Health nowadays. We look at things, we say things that people think is impossible, and then we work towards it. When we said we'll move maternal mortality less than 300, people thought it was an impossibility. Well, you come to us in 2 weeks' time, or we'll be launching an assessment officially done by Global, WHO, then you will hear if we are there or not. So nothing is impossible. So we may be there by 2030, 12 per 1,000, if we all want to be there.
After this graduation and conferment ceremony for neonatal nurse them, make the Chief Nursing and Midwifery Officer at the Ministry of Health, Matron Mary Augusta Fuller, been get this for say to the nurse here.
As you embark on the next phase of your professional journey, ladies, I encourage you to always strive for excellence and compassion in your work. You are now ambassadors of change in the neonatal health sector, and your contributions will directly impact the survival and well-being of our babies in our various communities. Each life you touch is a testament to the importance of your work, and I have no doubt that you will be at the forefront of improving neonatal care across Sierra Leone.
Where in the talk on behalf of incompetent Kerry Charlie, now one pan the nurse the way benefits pan this training, and it be talk about waiting at some of the things the way they learn.
Before, we are just attending to neonates without knowing most of the things. Like there are some babies who need resuscitation, but before, some people don't know how to do it, some of us don't know how to do it properly. But because of this training, some of us can do better. And also, there are some things we never know how to do, like we have a CPAP, which is improvised, because we have the mechanical CPAP, which many people don't know how to use, and because of the lights, we are training to use it, especially when we have babies who have respiratory distress and also preterm who needs to be placed on CPAP. But because of this training, they taught us the bubble CPAP, which is the artificial one. So now most of our preterm, immediately they be admitted to our units, we normally place them now on CPAP.
Then 25 Nosia end up assure say, then go implement the thing the way the Roland and in different districts them. For CC, they help reduce neonatal mortality in Salone. For the Society for Ready Democracy, Mira Karifa to counter the report.
Well, from that report today, inside the program, we come back and as we mentioned earlier, inside the program this morning, we get to talk to the Minister for Information and Civic Education, Wina Chernopa. Good morning and welcome to the program. Good morning, Salon.
Good morning, Assalamu alaikum, Eid Mubarak.
Belated Eid Mubarak.
Mubarak to una all. Since I know see una during that period, and I hope say Alhaji Sheikh Musa, I mean lead the prayer and alunge. You know, for the Jama.
The central community.
Okay.
Chief Imam.
Okay, good.
That check top the minister. Musa and Musa. I go explain.
Musa and Left.
Yes, I will explain it.
We to this after that.
We'll continue for stay with me inside the program. We'll come to you shortly. And Usman?
Inside the program this morning, we look at another issue inside the Advisor Human Rights Unit Commonwealth Secretariat Fulani Delamin say the Alliance of National Human Rights Commissions don't give grade A status to the Human Rights Commission of Salone because they don't do their work for protect human rights issue in the country. They talk this with the Commonwealth Secretary go get training to staff them na the Human Rights Commission of Salone. For more on this, make we join Mohamed Lamin Kebe.
Salone na part of the 56 country them na the Commonwealth League of Nations where the British government they provide leadership for, and for long term the Commonwealth don't help Salone with different supports from education, sports, the economy and other sector them. For continue then kind support the country, make the Commonwealth inside one 3-day workshop don't go get training to commissioner and staff them at the Human Rights Commission for improving capacity as we for deliver on their mandates when for improve the status of human rights in the country. The chairperson at the Human Rights Commission, Patricia Nansu Danema, been explained how the support been come about.
Let me, on behalf of the commissioners, express my gratitude to the Commonwealth Secretariat for bringing into fusion the request commissioners made in 2023 when we met in Geneva during Ghana's annual general meeting and subsequently followed by several Zoom meetings in Freetown with commissioners and staff. It is worthy to note that this is not the first time we are benefiting from the capacity building sessions by the Commonwealth. In 2012, we benefited from an extensive training on conducting public inquiries by the Commonwealth. And just to let you know that the expertise the Commonwealth provided to a very large extent aided us in conducting 3 successful inquiries. The Commission remains grateful for the Commonwealth's dedication to empower us with the knowledge and skills needed to address the dynamic challenges we face in terms of human rights promotion and protection.
But what's not the objective for this 3-day training? Patricia Nansu Danema again.
In line with best practices and the 2022 recommendations profiled by Ghana's subcommittee on accreditation, enhance the understanding of HRCSS commissioners and staff on key human rights aspects and fundamental principles related to critical human rights issues in Sierra Leone and best practices for national human rights institutions. Engage HICSL's capacity to identify, monitor, and report on emerging human rights issues such as business and human rights and climate change. Enhance the capacity of HICSL on the drafting and submission of alternative reports to the United Nations Human Rights Mechanisms with our latest submission, one to the Child Rights Committee in 2025. And finally, to strengthen the capacity of members of parliament on human rights to effectively and strategically engage with HRCSL on critical human rights issues impacting Sierra Leone in collaboration with our partners, the District Human Rights Committee.
The advisor, Human Rights Units, at the Commonwealth Secretariat from Lani Dilamini, top of the new recognition where the Human Rights Commission Salon don't get because of the efforts where you say the commission don't they do for promote human rights at the country.
Alliance of National Human Rights Institutions has granted the A status to your commission, Madam Chair, as a recognition of the important role that you have been playing for the past 14 years for the people of Sierra Leone. This is an impressive record, and we look forward to learning from many of the good practices that have been identified over the years, including your cooperation with civil society organizations through the district human rights committees and the work of your regional offices, both of which have joined us today for this workshop.
From Lani Dilamini, we end up calling on government for create policy them we go promote human rights in the country. For the Society for Radio Democracy, Mamelami Kebe the report.
The program now Good Morning Salute the country from the Society for Radio Democracy 98.1 FM. As we will introduce with studio guest earlier, we are the Minister for Information and Civic Education, Chernoba. We can talk about